So, hi everyone, my name's Rhiannon. I'm going to be talking a little bit about my personal ethics and how they play a role in my nursing care. So, just a little bit of background information. I graduated from Washington State University in 2013 with my baccalaureate degree. My first job was on a nephrology medical surgical unit, and then I quickly transitioned to an adolescent behavioral health inpatient unit at my hospital. When we talk about ethics, we've all learned that there are ethical principles as outlined in our book, those being autonomy, freedom, beneficence, non malfeasance, veracity, confidentiality, fidelity, and justice. In talking about my personal ethics, these are the ones that really speak to me: autonomy, freedom, non malfeasance, confidentiality, and justice. Autonomy, I think, is hugely important. I think patients have every right to make decisions for themselves and make decisions regarding their care. And I think that's something that we have to really work hard to respect, regardless of how family, friends, um, other people feel that are involved in their care. I think we really need to work hard to respect their autonomy and advocate for them in that aspect. Freedom kind of goes along with that, making sure that patients have the ability to determine what kind of treatment they want to receive and how they're going to receive it. I think autonomy and freedom really go hand in hand. Non malfeasance is one that is hugely important in psychiatric care. We have a huge proportion of our patients come in and who are hospitalized because they are unable to remain safe on their own. They're there because they injure themselves or they're suicidal and want to find ways to kill themselves. So it's a huge part of my job and my role to ensure that they are not given the opportunity to cause harm to themselves and do what it takes to maintain their safety while they are under my care. Um, Another huge thing for us, especially working with adolescents, is confidentiality. We have a huge number of patients that come in that are incredibly concerned about their peers outside of the hospital finding out that they are hospitalized and why they are hospitalized and don't want to be painted as quote unquote crazy because we still have such a huge stigma surrounding mental health in our society. And we have to work really hard to protect their confidentiality. Teenagers like to exchange things like social media information, and unfortunately, it doesn't take too much for so and so to go give so and so's information to somebody at school, and then all of a sudden everybody knows that they were hospitalized in a psychiatric unit. Another really big one for me is justice. I think it's hugely important that every patient receives the same kind of compassionate care that I give to anybody, regardless of their beliefs and their social status. It doesn't matter. Everybody should be getting the same kind of care. Um, like hands down, I think that's a huge one. So I'm going to talk a little bit about examples that I have from my career where my ethics have had to come into play and making choices about how I feel about things. So my first example was a patient that I took care of. She was one of the last patients I took care of on the nephrology unit. And she was this 97-year-old, full code, Russian-speaking woman who wouldn't eat. She had a KEO for nutrition and fluids. She was very limited in her mobility. I believe she was a two-person assist, and she was in renal failure. And her family was adamant that she get out of bed and sit up in the chair for extended periods of time, that she, remain a full code. And I just remember looking at this woman and she looked miserable. She just looked absolutely miserable. Being in the hospital, she'd brighten up when her family was there, but anytime anybody tried to interact with her, she just had this sour look on her face, and she just looked like she hated her life. And the unfortunate part was, I had no real way of communicating with her. We have a tele-translator system at my hospital, and my experience has been that older patients in general have a difficult time connecting with the translator via the computer. They don't seem to connect that it's a real person. I don't know if it's a hearing issue, um, but it's harder to communicate with patients in that way. It's really hard to figure out what it is that they really want. So looking at this woman, trying to understand, does she really want to be a full code? Does she want an NG tube? Does she want any of this? It was really hard to know what the right thing to do with her was. And I have no idea what happened to her. I left, like I said, she was one of my last patients that I cared for on the nephrology unit. So I don't know if she went home. I don't know if she ended up going to hospice. I really don't know. But it was definitely one of those moments of, is this right, what I'm doing? Is this really what she wants? And that was something that I definitely had to struggle with. Something that we run into a lot on my unit now is transgender youth. So I'm sure everybody knows that transgender youth are at higher risk for suicide when compared to other teenagers. One of the things that we run into a lot is parents not agreeing with the children in terms of validating the fact that they're transgender. So using their chosen name and using their proper pronouns can be a real struggle when you have a parent on the phone saying, I want to talk to my daughter Christy, and in your head you're like, oh, well, Sam says he doesn't want to talk to you. It's just one of those things where finding that balancing act of respecting that parents aren't ready for this transition, but understanding that the child who's in my care for often suicidality needs to feel supported in the fact that they are transgender. And in order to build a therapeutic relationship, it's huge to use their proper pronouns and use their chosen name. But it's definitely something that's a real struggle balancing, how to deal with the family who technically they're still legal guardians, so there's still that aspect of it, but respecting the patient's autonomy and their freedom and making sure that they feel safe where they are and are receiving the same care as everybody else. That can be a real struggle. And then my last example is surrounding the Involuntary Treatment Act. We all know that patients have the right to refuse care and refuse medications. They have the right to fire us if they want to, and that's something that we have to respect. And even with the Involuntary Treatment Act, which usually is in place because they're gravely disabled, they're not able to maintain safety for themselves, they're not able to make decisions for their own care, whatever it is may be. Even in those situations, most of the time they can refuse medications, they can still refuse assessments. They still have their rights, and balancing what must be done to maintain their safety versus what their rights as a patient are can sometimes be a little tricky. Sometimes people want to put kids in restraints that for me maybe is not as significant, and I would try de-escalation techniques or medications first, but we all have to gauge where we are in those situations and understand that no, this is what I need to do to maintain safety. But again, I think things like justice really come into play here. Just because a patient is aggressive or was aggressive 2 days ago doesn't mean that today I get to treat them any differently. They still get the same kind of care and the same kind of value that every other patient gets. Just because they had a bad day a few days ago doesn't mean that I can treat them like a criminal the next day. That's not how it works in my boat. So thank you for listening. That's really the end of my ethical foundation, I guess. I hope you guys learned a little bit more about me and a little bit more about what I do. I love where I work, and I really enjoy getting to see that change in the kids when they start feeling better and doing well. And I hope to continue learning with you guys. Thanks.